When you get sick, you expect your health insurance to help. That's what you pay for, right? But in America, getting care often means paperwork, phone calls, denials, delays, and a bill that could bankrupt you. All while your insurance company makes record profits. In 2023, UnitedHealth Group, the largest health insurer in the U.S., made over $22 billion in profit. Its CEO, Andrew Whitty, took home more than $20 million that same year. And that's not unusual, because in the U.S. healthcare system, the worse it works for you, the better it works for them. This is Empire Report, and we're following the money. Health insurance was created with a simple idea. You pay in when you're healthy. When you get sick, the system helps you. But in the U.S., that promise has been flipped upside down. The insurance industry doesn't actually want you to use your insurance, because every dollar they spend on your care is a dollar they don't keep. So they've built a business model around denial, delay, and confusion. A model where it's more profitable when you don't get treatment. Take prior authorization, one of their favorite tools. That's when your doctor says you need a treatment or test, and your insurance company says, "Hold on, we'll decide." In 2021, Medicare Advantage plans issued over 35 million prior authorization requests and denied more than 2 million of them. That's about 1 in every 7. And these aren't small things. We're talking about cancer treatments being delayed, heart medications being denied, patients forced to wait weeks, or give up altogether. Then there's claim denials. That's when you already got treated, but your insurance decides not to pay. In 2022, nearly 1 in 5 in-network claims under ACA plans were denied. Imagine getting surgery, then finding out your insurer won't cover it. It happens every day, and for patients, it's devastating. But for insurance companies, it's just business as usual. The less they pay out, the more they keep. And the results speak for themselves. UnitedHealth, Cigna, Aetna, Anthem, all reporting billions in annual profits. In 2022 alone, the 5 biggest insurers made over $60 billion, all while tens of millions of Americans struggled to pay medical bills. And the CEOs, UnitedHealth's CEO made $20 million. Cigna's CEO made over $91 million in 1 year, mostly in stock awards. That's not healthcare. That's a Wall Street bonus system. But it goes deeper, because some insurance companies don't just insure you, they also own the clinics, the doctors, the pharmacies. UnitedHealth also owns Optum, one of the largest healthcare providers in the country. That means the company gets paid as your insurer and as your doctor. They control how much care you get, when you get it, and how much it costs, at every step. And there's no one stopping them. Why? Because the health insurance industry spends millions of dollars lobbying Congress every year. In 2022, the entire health sector spent over $700 million on lobbying, a record high. And insurance companies were right at the top. They donate to both parties. They hire former government officials. They write the talking points lawmakers use on TV. And they help kill any bill that might reduce their power or profits. You may have heard of Medicare Advantage. It's a private version of Medicare that sounds good, until you look closer. In theory, it offers more flexibility. But in practice, private insurers have used Medicare Advantage to overbill the federal government. How? By exaggerating patient diagnoses. A company might code a patient as having severe diabetes, even if they don't, just to get more money from Medicare. In 2022, federal auditors found that 8 out of 10 Medicare Advantage insurers submitted billing data that looked suspicious, and that fraud costs taxpayers billions every year. And still, enrollment in Medicare Advantage keeps growing, because it's heavily marketed, and because politicians don't want to pick a fight with companies that fund their campaigns. But this isn't just about policy or statistics. It's about people. Like the woman in Texas who was denied a liver transplant because her insurance didn't consider it medically necessary. She died waiting. Or the cancer patient in California who had to crowdfund his chemo treatments after multiple delays from his insurer. These aren't glitches in the system. They are the system. A system where your health is a cost, and your suffering is a savings line in someone else's report. Let's zoom out for a second. Right now, over 100 million Americans are in medical debt. About 1 in every 3 adults. Many of them already have insurance. But it wasn't enough. And while they're skipping doctor visits or rationing prescriptions, executives are getting stock bonuses and corporate jets. Because in America, healthcare isn't about health. It's about profit. Insurance companies are not just part of the healthcare system. They've taken it over. They deny care. They control access. They rig the rules. And they shape the laws that are supposed to protect you. So, who really profits when you get sick? They do. The insurance companies, their executives, their shareholders, the politicians they fund. Everyone, except you. This is Empire Report, where we follow the money behind power. If you found this story eye-opening, hit subscribe. Because the numbers always tell a story. We just have to read them.